My name is Dr. Saqib Ghani, and I'm a consultant intervention cardiologist working at Darren Valley Hospital in Dartford. So, in my childhood, I spent a lot of time in and out of hospitals, attending my mother who was quite unwell. And that brought me very close to healthcare as a profession. So, I always developed this empathy for patient care. And that's why I wanted to be a doctor when I was a young student in college years. And then I fulfilled my dream. I believe heart is the most important organ in the body, and treating patients with heart disease gives me the opportunity to deal with a variety of patients on a daily basis, including patients on the ward, patients in the clinic, and doing some operations and procedures in the cath lab. And that's what I enjoy the most. So I enjoy the anatomy and the physiology behind cardiac disease and the quick response we get from the treatment. So that's why I always had the passion for cardiology as a medical student, and I'm absolutely I'm pleased to be a cardiologist now. So in my job, I deal with patients with acute cardiac problems. The most rewarding thing is a rapid recovery of a patient who's come in with a life-threatening emergency. So people who come in with acute heart attacks, when you treat them, they go home the next day. That's extremely pleasing and rewarding. And also people who suffer with angina and coronary heart disease, their quality of life is affected. Sometimes they can't do their work properly. And once they undergo treatment, and when you see them at follow-up and realize that they're back to work, enjoying their life, exercising, that's the most rewarding thing in my job. The feedback I've had from patients over a period of time points to the fact that I'm a very good listener. I would give my time to them and listen to their symptoms and their history. And I show a lot of empathy. And I think that keeps me very close to my patients. I build a very good rapport with them and their relatives. That's something they value in my services. And I think that's the most important thing for a patient to be able to cater them according to what their needs and expectations are. What I value in patients is honesty and openness about their symptoms and medical history, because that is a fundamental piece of information we need to diagnose them properly. So it builds a very good patient-doctor relationship. I do. I'm a cardiologist and I enjoy exercise myself, and I prescribe exercise for patients. I think it's extremely important. So a catchphrase I use at work or outside work is that heart disease runs in the families if people do not run in the families.